So I recently got this email about supervising international medical graduates. And even though I'm not actually a current supervisor of international medical graduates, I thought it'd be interesting to go through what's the requirement for supervisors of IMGs here in Australia. Hello there, I'm Anthony Llewellyn. I'm the career doctor. I'm a real doctor. I'm here to help you manage your career right here on YouTube. So today we're having a look at the requirements for supervisors of international medical graduates here in Australia. And as I say, even though I'm not a current supervisor of IMGs, certainly have supervised many in the past, I got this email the other day from the Medical Board of Australia. I'll read it out to you. Dear Dr. Anthony Llewellyn, or Dear Anthony Llewellyn, the Medical Board of Australia Supervision of IMG SALT compliance have been engaged by the Medical Board of Australia, the Board, and AHPRA to provide the Board's online education assessment module for medical practitioners who supervise international medical graduates. Your email has been provided to take the online module. A copy of the agreement is available on the board's website, along with the guidelines here, which came into effect on 4th of January 2016. The board requires all principal supervisors, co-supervisors and term co-supervisors to satisfactorily complete the online education and assessment module on the guidelines. As a current supervisor of one or more IMGs, you've been enrolled for the module Supervision of IMGs at imgp.saltcompliance.com with a username and a password. Sorry, don't get them from me. You're required to complete this module within 1 month. There is a lesson and a 10-question quiz. The lesson is optional. You must get 90% or above to satisfactorily complete. Quiz should take up to 15 minutes to complete. Please do not use Firefox. That's from AHPRA. So what I'll do is I'm going to, firstly, they provided a handy link there in the email about the requirements for supervision. So let's just have a quick look through here. So this is the Medical Board of Australia website, which is under the Australian Health Practitioners Regulation Agency. There's a lot of information on this site, a lot of information about various types of registration requirements. You'll see here there's a kind of a subheading under registration for international medical graduates with a lot of information there as well. And here's the guide for supervision. So the board's guidelines are listed here. They were changed on the 4th of January 2016. So these changes really aren't that new anymore. But the key changes then were changes to the requirements for supervisors to do online education and assessment. That's what we're going to do right now. Changes to the number of IMGs permitted per supervisor. I think this was one of the key changes because what was happening prior to this was, particularly in general practice, there were too many doctors being supervised who were requiring direct supervision under the remit of one particular supervisor, and that was obviously a little bit unsafe. Clearer descriptions of the 4 levels of supervision. It's probably worth us going through that a little bit. A revised supervision arrangements for IMGs working after hours on call. These are, in locum services, these are times when there's generally a little bit less supervision available, so that makes sense. Process for appointing temporary supervisors and a new audit provision. And then stuff about the transitional arrangements, the online education, etc., etc. Let's have a look at these guidelines just to check them out a little bit. So here we are, guidelines for supervised practice for international medical graduates dated 4th of January 2016. This will be informative to a number of reviews coming through the standard pathway, competent authority pathway, specialist pathway, really, because once you get a job and get registered, these are the rules under which you're supposed to be working, particularly in relation to your supervisor. So these guidelines apply to all international medical graduates who are granted limited registration or provisional registration. All IMGs who are granted limited registration or provisional registration must be supervised. And it is your personal professional responsibility to make sure this occurs. Yes, your supervisor has certain responsibilities and obligations, but at the end of the day, if you don't comply, if things don't occur in alignment with these rules, then it is your responsibility to have made sure that it happens. They don't apply to Australian and New Zealand graduates with provisional registration interns who have their own rules for supervision there. So the purpose is to set out the assurance that the Medical Board of Australia provides the community about the practice of medical practitioners and monitor and support IMGs throughout that period of limited or provisional registration, mainly with the aim to get you to general or specialist registration. They talk about what formal supervision should constitute, including feedback about strengths and areas for development and strategies to improve performance and what good supervision looks like. They also talk about how they decide the level of supervision that is necessary, and they take into fact a number of factors, including the position that you've been offered and the level of risk. So, a specialist role would be more significant and potentially more risky than, say, a resident role. The context of the practice, and that's usually about who else is around to support you, not just doctors, but others. Supports available, and qualifications, training, experience. So generally speaking, the more work and training you've done, the more likely you are to be appointed to a higher level of supervision in terms of not needing so much direct supervision. And they say here, during the period of supervision, the board approves a principal supervisor as well as co-supervisors. And that's a big change, because I think one of the problems was often you had supervisors swapping all the time. So they do encourage, when you get registered initially, that there's a number of supervisors, so there's like a fallback. At the end of the period of registration, after considering all the work performance reports, the board determines whether you are suitable for ongoing registration. Now, hopefully you've got to the point of getting general or specialist, but if you need an extension, that also can apply. Principles of supervision. Let's just pick through these, because I don't want to spend, well, it's only 9 pages, so obviously you can't just read it verbatim to you, but all IMGs will have a principal supervisor. The principal supervisor is approved by the board, is the overseer of supervision, should nominate one or more co-supervisors, is responsible for ensuring adequate supervision, delegates supervision, so that can be to co-supervisors or to other doctors like registrars, etc. If you say in a hospital, must agree in writing to provide supervision as prescribed by the board, and provides reports to the boards about your performance as an IMG. Then there's sort of duties of co-supervisors, and then there's also term co-supervisors. So when I said one of the changes was to sort of limit the number of people who can be supervised, particularly under some of the more direct levels of supervision, that created a problem for hospitals, where often you would have IMGs appointed to like resident jobs where there is quite a lot of support, but people are changing a lot, and it isn't uncommon, and wasn't uncommon for one person to be the nominated supervisor for a number of people. So you can see here that something like the director of medical services or director of training may be actually appointed as a principal supervisor for a number of doctors, and then they can allocate term co-supervisors to look after them through the rotation. The requirements for all supervisors here, these include not having conditions imposed on their registration, and must not be in a relationship with the IMG, must not be employed by the IMG, or makes sense in terms of a conflict of interest perspective, and the board cannot grant approval or revoke if they receive a notification about it. Requirements for principal supervisors, co-supervisors, and term supervisors should have specialist registration. Now, this is where I struggle a little bit, to be honest. I think certain doctors who are on the pathway to becoming specialists in this country, say advanced trainees, even basic trainees really, can be taught the principles of feedback and professionalism in terms of oversight of doctors at more junior levels in the hospital. But anyway, they are saying that you have to have specialist registration. I think the other problem there is that we end up with this pyramid effect where the specialist is the supervisor for advanced trainees, basic trainees, fellows, residents, senior residents, interns, IMGs, etc., etc. They really do have to delegate some of that responsibility out in order to actually ensure good supervision occurs, particularly again in a hospital setting. There is an out clause though if you have general registration as to why you can be considered. So that might be a case for someone who's like an education fellow or registrar or something like that. And again, you'd probably need to have done some training in medical education or maybe management, that sort of thing. So great example would be someone who's training on the medical administration trainings. They must be appropriately qualified, preferably in the same field of medicine. Well, that again would be a bit of an issue if it's a rotating doctor. Should have the minimum 3 years full-time equivalent practice. Must complete the online education. And here we get down to the number of IMGs permitted. So the board will not normally allow any practitioner to have direct supervisory responsibility for more than 4 IMGs, and that's actually quite a lot. And so that can create a bit of a headache in terms of monitoring it, but I think that's a generally decent principle. There are some exemptions here for DMSs and directors of clinical training about how they provide explanation to more than 4 doctors. Otherwise, you do have to provide explanation. There's arrangements for appointing temporary co-supervisors. Then there's some description of what supervision looks in a formal and informal setting. I'm not going to go through that in too much detail. That all is probably easily understood. What I'd like to do though, before we go on to the training module, and we'll keep this open because it's probably going to be helpful in filling in the quiz, is just go through the 4 levels of supervision. So just so you understand that. So these are, I guess, again, determined on a number of things: your qualifications, your previous experience, your recency of practice and the scope of that practice, the position requirements and the level of risk and the location, the seniority of the position for hospital positions, any recommendations from, say, a PESCI, a pre-employment structured clinical interview, or a college. There's some more about supervision in general practice, and there should be supervision in hospital settings as well. Okay, so we often apply this level 1 to 4 in the hospital as well, but you can see these are the criteria determined for general practice. So level 1 supervision, basically the supervisor has to basically be there the whole time. Must be physically present at the workplace at all times when the IMG is providing clinical care, and you have to consult the supervisor about management of all patients. So you could be in another room, but after you see every patient, you have to talk to your supervisor. So you can see how this would have been a bit difficult if a supervisor had like more than one person on level 1 at a time. I guess they could be hopping between rooms, but it was probably leading to issues where the IMG wasn't able to check in on each and every patient. And you can't have supervision via telephone contact or other sort of electronic mechanisms. So again, this would be limited as well in terms of, let's imagine you're doing after hours, or how are you going to do the after hours, unless you're just tagging along with your actual GP supervisor. If we're going to apply this to the hospital setting, this is kind of equivalent to what an intern does. They would always basically be checking on each and every patient with someone more senior. It's probably not as strictly applied as that, but in terms of everything they do during the day, but anything significant certainly. Generally, for example, the rule in the emergency department for interns working in the emergency department is that they talk to the registrar or the consultant about each patient that they've seen. You can see how that would take up time and slow down the efficiency of said intern. Residents get a little bit more latitude as to registrars. So a resident would be at this sort of level 2 supervision. And from a general practice perspective, they say his supervision must be primarily in person 80% of the time. But where they're not able to be present, they must always be accessible by telephone or video link. So it's a little bit more indirect. And they have to check in on a daily basis. So they don't have to talk about every patient. So there's a little bit more responsibility and entrustability given to the IMG to know when to get advice. So you can see in that circumstance, there also might be a little bit more limited opportunities to do after hours, though again, you'd have to be at least available to phone in, although we might just go here and have a look here in terms of the specific requirements about after hours, on call, off site, etc. So that would be equivalent to a resident in a hospital. Then we've got level 3 where the IMG is permitted to work alone provided the supervisor is contactable. That's kind of at the level of what a trainee, maybe a senior resident might do in a hospital. And that also might be what you might get appointed to if you're a specialist under partial comparability. And then the level 4, which is the most relaxed, I guess, they take full responsibility for each individual patient, and really the supervisor just provides oversight, is available, and must periodically conduct a review. So that would be equivalent in the hospital to, well, there's not really much equivalent in the hospital to that, possibly like a senior fellow. From a specialist IMG perspective, actually the other one would be career medical officer, and from a specialist IMG perspective, that would be equivalent to, say, someone on substantial comparability. And then they talk about how you can use this as a guide for hospital-based position. And then there's some information about after hours. So for example, in an IMG in a hospital-based position on level 1, may be rostered for after-hours services in the hospital if their supervisor is also physically present at the workplace and is available to consult about the management of all patients at all times when the IMG is providing clinical care. Now that's interesting because that wouldn't happen with interns, unless the registrars are being appointed, and we get back to this issue about having specialists responsible for everything. There wouldn't necessarily be the actual supervisor for the intern in the hospital at every time that they're doing after hours. So sometimes that creates headaches for hospitals when they've got an IMG under level 1, and often what they'll be trying to do is move them to level 2 so that they can do a bit more after hours within the normal roster pattern. You can see here about the reporting requirements. There's an initial 3-month report. Then they talk about after the first report at 3 months, there must be a report provided at the time an application is made for renewal for registration, and then annually thereafter, unless otherwise directed, and that's usually, you're working towards getting off this registration. And then the specific requirements for IMGs with provisional registration, they may, as it says, you may be eligible for general registration in the end of 12 months supervised practice, so they look at that, and they do audit supervision requirements. So look, that's just a brief snapshot overview of all the supervision requirements. Not sure what I'm going to title this video, but I think it's maybe coming around to a bit of an explanation of the supervision requirements for IMGs in Australia. And by the way, if you're liking this content, leave me a like or comment below so that I can know if I should make some more. You might have some questions about the supervision requirements or the processes. You found some oddities or issues around the various levels if you're currently working as an IMG under provisional or limited registration. If so, leave me a comment or a question below. As always, if you feel like subscribing, if you're enjoying these videos, do so and turn on notifications so you can know when the next video goes out. So anyway, let's pop into the training. Now, I've taken the liberty of signing in already, and so we'll just have a look at this. I might just blow that up for you guys so you can see it a little bit better. Thank you for agreeing to, personalised. Hello, Anthony. Thank you for agreeing to be a supervisor of international medical graduates. Please view the video message from Dr. Joanna Flynn, Chair of the Medical Board of Australia. If the video is not visible, please click. Medical Board of Australia appreciates the commitment of medical practitioners who give their time to supervise IMGs, provides assurance to the board and the community that practice of IMGs is safe and is not putting the public at risk. A link to the guidelines, a bit about the education module, some help, and I need to complete this within 1 month. Please select my training to commence the module. So let's have a listen to what Dr. Flynn has to say.
Chair of the Medical Board of Australia. On behalf of the Medical Board, I want to thank you for taking on the role of Supervisor for an international medical graduate. In this context, we're talking about doctors who trained overseas and who are working in Australia in areas of need or postgraduate training positions and have not yet met the requirements for full registration in Australia. Supervision is critical in assuring the board and the community that these IMGs are working safely. Without medical practitioners who are willing to take on the role of supervisors, IMGs wouldn't be able to work in Australia and communities would miss out on these much needed services. The Board Supervision Guidelines outline the principles of supervision and the Board's expectations of IMGs and their supervisors. The guidelines were first developed in 2012 and the Medical Board has recently revised them and made a number of changes. It's important that supervisors understand their role and responsibilities. This module won't take long and we hope that you'll find it useful. We're not trying to teach you how to supervise. Many of you are very experienced supervisors and have had good training in your role. We do want to make sure that you and the IMGs are clear about your responsibilities to the board and to the community. The board appreciates your commitment to IMG supervision and to ensuring the safety of the public. Thank you.
Okay, thank you, Joanna. So let's head into the training, shall we? All right, the courses I need to complete are the following. Supervision of International Medical Graduates. Incomplete, complete certificate. Let's click on that. Now I am in Chrome. So they said don't do it in Firefox. And I guess module, so I guess that's not quite clear there, but it says not started and you get a hyperlink when you click on this. So I guess we click on the lesson then. Supervision of International Medical Graduates. Purpose of the module is to ensure that supervisors understand their roles and responsibilities. The guidelines are available on the My Training page. Yep, I've got them open here. Put them back up to the top there. Maybe page 2. Okay, should review the guidelines and opt to complete the lesson. The lesson should take up to 30 minutes to complete. Supervisors must complete the quiz and get 90% or above. Click on the quick facts. Click on the quick facts. There's a bit of a tongue twister. Menu button above to view a summary of the lesson. Click on exit. Okay, so we've got quick facts. Quick fact sheet. Okay, supervision provides assurance. All IMGs have a principal supervisor and co-supervisors, and there may be temporary. All supervisors should have specialist registration. You may supervise up to 4 IMGs. All IMGs should have both formal and informal supervision. I need to be satisfied that IMGs are developing competencies in clinical areas. What about non-clinical competencies, by the way? The level of supervision is dependent on the position. IMGs may work after hours, etc. Restrictions apply to locum positions. So, as I think I said in a previous video or a blog, it's very unlikely that you're going to be able to work as a locum other than in a few sort of special schemes in general practice that have been set up. But otherwise, you need to have your general specialist registration to be a locum. Levels of supervision may change the level of supervision. The supervisor must provide orientation and work performance reports, and there is an audit process. Okay, great. Quick fact sheet. Oh, there's a table of contents. Is it going to tell me what I'm going to learn about? Nope, that's blank. I'm on the home page. Yep. Okay, well, okay. No, it does say I can select a topic. Doesn't seem to be anything there. Let's click through. The Medical Board of Australia has developed guidelines, which we've read through. These guidelines apply to international medical graduates under the law, and they are granted limited or provisional registration under that law. Understood. Supervision provides assurance to the board and the community. Supervision also monitors and supports IMGs. And then the formal supervision processes monitor and assess IMG performance within a structured framework. Yep, we've talked about what good supervision should be. So again, this is basically really repeating the content here, isn't it just? Now, in terms of some critique of the e-learning approach here, by the way, we haven't got a table of contents as far as I can see. I'm on Chrome, Salt Compliance, and there's no indication as to how far I am into the training. That really tends to irritate e-learners. You need to give us some feedback. If it's going to be long, let us know. We want to gauge how we're going. Also, this is one where you can do the dreaded right click, can't you? Just click, click, click. Yep. So, there's various approaches to that. I'm not saying you should hide this button elsewhere, but sometimes you might have things here on some pages that stop you from clicking forward to make sure you're actually paying attention. What's often useful is a quick video that you have to watch all the way through before you can forward. Not to say people can't do that and then do something else, but it just helps a little bit. So in terms of your approach to e-learning, this is what I would do. Anyway, the board will consider a range of factors. Yes, we'll approve a principal supervisor as well as a co-supervisor and determine whether the IMG is suitable for ongoing registration at the end of the period. Okay, so quick facts, the same thing. Yep, okay. Okay, click. See, I can go past this. Yeah, so anyway, I would probably make this one the first stop, can't pass without clicking on everything, just to make sure people are watching and reading. Supervision arrangements have been approved, must be in place at all times. Click on the buttons below for definitions. So we've read through this, what a principal supervisor is, the chief supervisor responsibility for the overall performance, setting in place the plans for the IMG, and the co-supervisors who help out and are formally there. They may have active supervision roles, or they may also just fill in when the principal supervisor is not there, or they may themselves complete the reports, and then there's termed co-supervisors as well. Click on the button below for definitions of requirements for all supervisors. Can't have supervision, must be granted approval. And can't have a relationship with the IMG. Principal supervisors, co-supervisors. Supervisors may have general registration under circumstances. Supervisors may supervise up to 4 IMGs. Supervisor who concurrently consults with their own patients while supervising IMGs may supervise up to 1 IMG on level 1. So this is what I'm talking about. You can't have one in one room, one in the other. You've got to be providing the direct oversight that the first on level 1 needs, and then up to 3 IMGs on other levels. However, if you don't consult with their own patients while supervising, so you're a specialist in the hospital, then you can have more than 1. And if you want more than 4, you have to submit a proposal, unless you're a DMS or Director of Clinical Training. Principal supervisors may delegate. They can appoint temporary supervisors can be appointed and they don't need to be approved by the board. So this is one of these practical solutions so that you're not constantly filling in forms, going back to the board, and IMGs are being caught on technicalities. There are limits on how long you can be a temporary supervisor. There's a maximum 3 non-consecutive 4-week periods per calendar year. So 3 months basically. If you're absent for more than 4 weeks, you have to have a co-supervisor. So that's why it's a good idea to have them already. Definitions of formal supervision: review and feedback, observation of practical skills, discussion of difficult or unusual cases, cultural management issues, medical record review. Nothing about teamwork, hospital systems, healthcare systems, communication. Interestingly, this is just like in day-to-day advice. So formal is like scheduled, and regular and informal is daily. Usually, I need to be satisfied the IMG is developing. They can assess a patient accurately, recognise a sick patient, know when to refer, can prescribe safely, can order a test and interpret the results, can screen, can treat and manage, effectively communicate, well, that's good, understand relevant legislation, that's good. Again, nothing about teamwork in the hospital setting or how health systems work or anything practical that's practical to your development in a health service. All right. Oh, checklist. Oh, so this is your responsibility. The IMG must schedule regular meetings with their supervisors, get supervision and development goals together with the supervisor, contact early, recognise their limits, obtain approval for the board for changes to supervision arrangements, and inform the board if supervision is not occurring as per the requirements. So as I said, at the end of the day, this is your responsibility. Yes, the supervisors have a responsibility in this, but it's your registration. It's your ultimate responsibility. Supervisor is to make sure the IMG is practicing safely, observe the IMG, provide feedback, address problems that are identified, notify the board immediately if there's concerns, notify of non-compliance, and verify the IMG is practicing in accordance with the working range. Oh, there's a continue the list. See, I would have missed that. Ensure approval of the board has been obtained for proposed changes. Inform the board if you can't provide supervision. Provide an orientation. Provide work performance reports to the board. Agree to provide supervision at the level determined and be clear about how they can be contacted. Probably should do the first thing listed actually by the IMG when the IMG is practicing during working hours and after hours. Let's just go back to the other one to see if I missed anything. They should probably be clear about how to make contact as well, but there's nothing missing there. So you've got to wait for this to scroll through apparently. Oh, this one you're not allowed to move past until you've... Was that the end of the module? No? Okay, there is more. Interesting. So at this point, I'm actually made to read. I would have probably put a stop before going there a little bit earlier on. Oh, the employer must ensure supervision, so the employers have responsibility here as well. Facilitate protected time. Ensure the IMG is adequately oriented to organisational policies and procedures and advise the board of any concerns. Great. Level supervision required depends on a number of factors. Now, I'm probably going to edit some of this out because this is starting to seem like a fairly boring video. Qualifications, previous experience, whether they're recently practiced and the scope, requirements of the position itself, the seniority of the position for hospital positions, pre-employment or pesky results and college results. Click. And here's the 4 levels of supervision. We went through those in detail, so I'm not going to just go over them too much again. You can see them there. As I said, level 1 is the most tightly supervised. Level 4 is the least tightly. 1, 2, 3, 4. And then we can apply this levels of supervision in the hospital, but other supervision structures can be applied as well. Supervision of IMGs, more info. IMG may provide after-hours services at their approved workplace if supervision is provided by an approved principal supervisor. For example, an IMG in a hospital-based position on level 1 may be rostered for after hours if the supervisor is also physically present. As I said, that's not usually the case. An IMG may work overtime at their approved workplace provided they comply with supervision arrangements approved by the board. An IMG on level 1 or 2 supervision cannot be approved for a position which consists solely of on-call or home visits. So that's to stop you being sort of like one of those doctor to your door arrangements where you're much less likely to get supervision. Basically, to be honest, those programs don't work if you have to have a supervisor tag along with you the whole time. IMG may provide on-call or off-site visits as an adjunct to the approved hospital general practice position, provided they comply with the requirements. For example, an IMG can go on a home visit if they go with their supervisor. And an IMG on level 1 or 2 is not permitted to provide locum services. So as I said, the options for IMGs without, general registration or specialist registration to do locuming is pretty limited in Australia. The board may change supervision arrangements at any time. And then information about the reporting requirements, 3 months renewal. You do have to check in more regularly, and this is just the amount of times you have to go back to the medical board. And they do have templates for completing these. And there is an audit process. I'm pretty sure we might be close to the end of this module because it follows the structure of the guidelines. End of lesson. Click the exit button to exit the lesson. You can access the quiz from the course homepage. I will do that now. Okay, so I've completed in progress with my lesson. Okay. Why it didn't give me a completed, interestingly. Well, let's do the quiz and see what happens. The quiz should take up to 15 minutes to complete. I reckon it won't. There's 10 multiple choice questions. Once a level of supervision is approved by the board, we're going to show how good I am at understanding all these processes and how much of an expert I am as when working as a doctor in Australia. So hopefully I do pretty well. Okay, question 1 of 10. What do we reckon? Once the level of supervision is approved by the board, a principal or co-supervisor can change the approved level of supervision following assessment of the IMG's work performance. No, that is not true. You have to go back to the medical board. Let's see. Oh, they're not going to tell me until we get to the end. The principal supervisors are responsible for overseeing the supervision, ensuring adequate supervision, ensuring that co-supervisors meet requirements, providing reports to the board about the IMG's work performance. This is one of those, all of the above ones. Of the IMGs that a supervisor who currently consults their own patient is approved to supervise, goodness, a poorly worded sentence, the maximum number permitted to be on level 1 is 1. You work at a practice with 2 practice locations, and you work at both locations, half-time at each. You plan to employ an IMG who needs level 2 supervision. They will work at one of these clinics full-time, and you will be the supervisor. Will this arrangement meet the requirements as outlined in the supervision guidelines? Well, unless there's a co-supervisor at the clinic the rest of the time, so they didn't clarify that wouldn't, because it has to be 80% of the time. So that's no, because you'll be away for half the time. Which of the following is a topic that must be included in the orientation to the Australian healthcare system? What did they say there? Let's just... Okay, so there's a specific guideline for the orientation report, which look, I'm going to assume it's probably one of all of the above. It should be, because these are all things that are not well understood when you're coming as a doctor from overseas in Australia. They're very specific to the context. Let's just look it up, see whether we can find it. There we go. There's a document that we can read. So I'm going to learn something here, possibly. So this is the report that you fill in when you've oriented your IMG doctor. It's the Orange 30. And Australian Orientation Australian Healthcare System, Structure and Funding of the System, State Department of Health, Medical Board of Australia, AMA, Specialist Colleges, Postgraduate Medical Colleges, Councils. I don't know that the AMA, interesting the AMA is there and not industrial organisations, but anyway. Provider and prescriber numbers, PBS scheme, doctor's bag, okay, hospital practice, mental health legislation, professional development. You would think that there was something about interpreters somewhere here. Did we talk about interpreter systems? Oh yes, interpreter service, drugs and poisons. So I think that pretty much covered everything. Let's just go back. Yep, PBS, yep, all of the above. I thought as much. All principal supervisors must be approved by the board. True. You are the principal supervisor and the co-supervisor has serious concerns about the IMG's practice. What must you do? Ask the co-supervisor to manage it? I don't think so. Discuss the concerns with the co-supervisors and make arrangements to manage it, including reporting to the board if necessary. Reduce the number of IMG's shift sessions. That's pretty obvious as well, isn't it? Temporary co-supervisor must have specialist registration, can only supervise the IMG for a maximum of 4 weeks at a time, can be appointed by the principal supervisor if the situation is urgent, but must be approved by the board within 4 weeks. Must complete the online education assessment module. So remember we talked about it's a maximum of 4 weeks at a time, so it's going to be this this option here. As you said, there are get out clauses for why you don't have to have specialist registration, and this is one of those instances where you don't need one. We'll see, we'll be able to find that in the guidelines here. Here we go. Requirements for principal supervisors, co-supervisors, and term co-supervisors. So these are the ones that all have to have specialist registration. So the temporary supervisors don't. So that can be like an advanced trainee. Again, that's a kind of a practical thing. So you can see here, temporary supervisors don't require board approval, don't have to have specialist registration, don't have to be in the same field of medicine, don't have to even have 3 years full-time equivalent practice. So you could be like a resident apparently. And you don't have to complete the online education module. So that's kind of having someone to fill in at the last minute just to make sure the IMG is looked after, but not allowing it go for too long. You are the principal supervisor and there are 2 co-supervisors who provide the day-to-day supervision. You don't need to... Negative question. That's not a good quiz design either. You don't need to meet with the IMG if the IMG is having regular meetings with one of the co-supervisors. You don't need to complete the work performance report. This can be done by the co-supervisors. Tell the board when you take annual leave. Tell the board if you are unable to continue as the principal supervisor if one of the co-supervisors can take on the principal supervisor role. Well, that's incorrect. You don't need to tell the board when you take annual leave for providing day-to-day supervision, but you do need to complete the work performance report, and you do need to meet with the IMG as well, so it'll be annual leave. I am a supervisor of IMGs and interns. I should refer to the board's guidelines, supervised practice for IMGs, for the supervision of IMGs, interns, both IMGs and interns. Well, there are only 4 IMGs. Okay, moment of truth. Let's see how I went. Okay, well, not moment of truth. Submit answers. I can review or change. Moment of truth. Waiting for SALT compliance. And overall it wasn't a bad module, but I do think that could make a few improvements. Oh, okay. You have now completed your quiz. Well done. You have passed the Supervision of International Medical Graduates quiz. The pass mark is 90% and you scored 100%. Woohoo! To view your quiz results, click Quiz Summary Report. I wonder if they give you some comments. No. They don't tell you why the right answer is the right answer either. Okay, well, okay, so let's go back to my training. I presume I get a little certificate. Completed the quiz, passed. Why is that in progress still? Well, click here to view your certificate of completion. I'm not going to print that. And sole compliance. There we go. So I can now successfully supervise international medical graduates again. Okay, well, so once again, I hope you've learned something. As always, if you're enjoying these videos, leave me a like and a comment, or turn on subscriptions and turn on notifications, and I will see you in the next video.